So preventive medicine can be, as opposed to treatment, diagnostics, preventive medicine is really designed to engage in behaviors. And so what we're trying to do is promote good behaviors, and we're trying to manage or eliminate bad behavior. So a good behavior might be taking your medications that your doctor's prescribed. A bad behavior might be tobacco use or eating too much. So that's really the core of preventive medicine. Now, why are we hearing about it so much? Well, honestly, the pandemic, COVID, has taught us all a lot about public health and epidemiology and the need for both treating conditions, whether it's an acute condition, a chronic condition, or an infectious disease, but also how do we prevent it? So, things like vaccinations, wearing masks, all of those things really are in the prevention category. An antiviral might be in the treatment category, and a COVID test, for example, might be in a diagnostic category. So prevention is just its own space within that.
That's excellent. And so really, this is not a new topic as such. It's just getting a little bit more attention because of—
We've been trying to prevent things throughout the ages. Sometimes the topic changes, but the reality is, we prevent, from being harmed, basically. We can be harmed by physical violence, by germs, or by things that break down inside our bodies.
That's excellent, and that gives a very good basic background about why we are talking about it. It's really not something that's fallen out of the sky, kind of thing. Anil, how about you? What do you think about this aspect? Your perspective about it?
Yeah, sure, Santosh. So I come from the public health background, so prevention is very close to my heart, and I think the way I think about prevention is more like, how do you prevent diseases and promote health? And there is a very, very old saying, as Pat was saying. I think an ounce of prevention is much better than a pound of cure. So as a public health and population health perspective, that's what we are trying to achieve through, making people aware of what would be a good behavior to prevent diseases and what could actually promote health. The other aspect that I see in contrast to the treatment versus prevention is that in medical schools, we are trained to provide care for patients one at a time. Public health measures are directed towards the populations. So what can we do that has a large impact on the population? And it boils down to what are those behavioral changes that we can bring in our lives that can actually help people on a large scale. So that's sort of like how I see the preventative medicine. In terms of why this is getting more attention, there are several reasons, I think. One is because of this internet, YouTube phenomenon, there are all kinds of experts are now coming along and talking about different kinds of things people could do. There could be 10,000 videos on how to get your six-pack abs, right? There may be, hundreds of videos in terms of how somebody became, cessation of the tobacco smoking. So this whole idea of the prevention just sort of like had spread, like a wildfire because of this awareness, and so much information is available. If you look at magazines in the December and January month, everybody's talking about health behavior, prevention, all kinds of stuff. So in general, there is a much larger wave of this idea. Second, I think, is driven by the medical profession as well. We all know CMS is looking for value-based care. value-based care means you have to improve the outcomes for the patients and less hospitalizations and less ER visits. So how you can prevent that to happen? So there is a element of prevention and early intervention, which is in the realm of prevention. So I think those two factors certainly are helping in my view.